Copyright disclaimer under Section 107 of the Copyright Act 1976. Allowance is made for fair use for purposes such as criticism, comment, news reporting, scholarship, and research. Fair use is a use permitted by copyright statute that might otherwise be infringing. Nonprofit, educational, or personal use tips the balance in favor of fair use. Thank you. Now enjoy the show.
Hey, what's up, y'all? Thanks for tuning in. This is Ray all day. Yes, Married to Medicine, one of my favorite shows on television next to Bell Collective. Oh, we gonna miss Bell Collective. Did you catch that review? I reviewed all of them. Yes, if you haven't seen them already, go back to my channel and just catch up. Also, I'm reviewing the other Housewife shows, Beverly Hills, Miami, Salt Lake City. They just wrapped up, and did I say Miami? And more's coming through. Love and Marriage, Huntsville just wrapped. I finished that one, and we got DC coming, and possibly Detroit. Now, I didn't record Detroit. I didn't review Detroit the first season. It was kind of blah, but they kind of grew on me, so I just may get into it if they come back. I don't know. I haven't got it confirmed yet, but yeah, child, Southern Charm, me and my girl, Psychic _ELB, and also we are both reviewing Drag Race season 16. Yes. So it's some stuff coming through the pipeline, y'all. Just go ahead and check out my channel if you haven't heard or seen them already. And thanks again for tuning in. Subscribe if you haven't already, and share, like, comment. You know how we do on this YouTube street. Well, boy, okay, episode 10. There's some stuff I want to talk about, especially with disparages of treatment. Of course, in healthcare. I am a healthcare professional. I'll let you in a little bit. So I do have some insight on some things, and I'm going to share them later on in this review. Not dental, but medical. But, it pretty much wraps up all in one when it comes down to brass tacks. However, here we go. So we got Dr. Simone, self-proclaimed leader of the group. Her and Toya is talking. Of course, they both like to drink. The two, well, Dr. Heavily kind of held back because, she was always with her brown in her cup. But she kind of, held back a little bit these last couple of seasons, maybe 3 seasons from being the resident lush, if I could say. Yeah. So I think the 2 resident lushes are Dr. Simone and Toya. Toya's in her wine bag. Of course, she's launched her brands with I forget who exactly she's partnered with, but she's doing her wine launch and brands and drinks. And Simone just likes her hard liquor, whatever suits, whatever floats her boat, child. But yeah, they're talking about things, and pretty much the basis of their conversation was how Toya is too critical on her husband, Dr. Eugene. We've all seen it, especially when she threw that biscuit at his mouth and told him to be quiet and and eat that bread. That was disrespectful. And of course, she was, making fun of his weight because, he was maybe 100 pounds heavier, if I'm not mistaken. That man was big back then when they went out of town. And I think that's that same dinner when Mariah broke the glass and was about to shank Dr. Heavy. Child, I think that's what did Mariah in. Anyway, we ain't talking about her. But yeah, Toya is way too critical, and just like Dr. Simone said, after speaking with her husband, who was also talking with her husband Cecil, who was talking with Dr. Eugene, he feels that his wife Toya is, he don't want to plan nothing because it's always going to be a disappointment for her, and she better ease up because Dr. Eugene looking real fine now that he lost about that 100 pounds. And you know how, hey, folks don't always make it. However, we know that he is in love with his wife, and she better stop talking about treating that man like that. She has, well, but then again, he's allowed her to do it. I always say, you show people how to treat you, you allow them to treat you wrong for the sake of. So, we're gonna have to get that together, Toya. That's what I said. So next we got T.S. Madison getting her mouth did and implants and carrying on with Dr. Heavenly. And then they go in to have a little brief description about transsexuals and how, the regular folks, they feel that they were born in the wrong sex or the sexual orientation, if I'm not mistaken. So they conform to whom they feel they are on the inside, and sometimes they change their body on the outside. So Timothy was him. Now she currently is T.S. Madison, and I believe that is her legal name. So we will always refer her as T.S. Madison. I believe she did say she got her name changed. So there's no longer that old name and no more reference to her as a man, even though she has her original organic parts. She has added on her parts and is taking hormone therapy, I believe. And I believe she said on her Maddie in the Morning show that her parts of her body are shrinking to, well, not the main part, child. We got to keep that long and strong. Shout out to the BBC. But yeah, so it's just, some learning, more learning, curves for folks to understand that everybody ain't the same. You know what I'm saying? So big ups to her. And I'm glad that Dr. Heavenly isn't so caught up in her narrow-minded thinking of being a disciple of Christ, because as she was getting to know T.S. Madison, there was a lot of verbiage and a lot of spillage of the Bible and whatnot and not what. And I think Funky Dineva, if you don't already know, helped her understand that she doesn't always have to say what's on her mind, because it can be offensive and come off as though you really are not who you portray yourself to be. And I'm going to say this. I really do believe that Dr. Heavenly is patronizing T.S. Madison more so than being an honest and true friend and doctor, especially when, T.S. got the coins. I do believe Dr. Heavenly is a clout chaser. I do believe Dr. Heavenly will do whatever she can to keep that money rolling in. And I do not believe she fully accepts T.S. Madison as who she is. Not maybe as demonstrative as Tasha K did, but that's just how I feel about it. I kind of see through her. I don't believe she's totally, on board with letter folk. I call them letter folk because it's a whole lot going on, and it's not offensive. That's just how I refer to the LG. I don't even know how the letters go. I just call them letter folk, and there's no disrespect. It's all love from here. But I just don't think she's totally genuine. Anywho, enough of that. So next we go to Dr. Jackie. She has a patient in her office who is, I believe the BMI was around 40, and that set Dr. Jackie off to, read her for filth in a nice way. She wasn't rude like she was to the girl back in season 1 and 2, who was a beauty queen, and she was telling her how she was way too fat and whoop-de-woo. So the woman in her office, her patient was a cancer survivor, big ups to her, and she admits to eating unhealthily. So Dr. Jackie is advising her on what she should do to, get her health back, per se. So big ups to Dr. Jackie. Mm-hmm. Next, we got Dr. Simone, y'all. She also has a patient in her office See that they hitting some real good talking points. First is with being, a helpmate to your spouse with Toya and Dr. Eugene. Next, we got understanding letter folk and all that they represent with T.S. Madison. Next, we're tackling, morbid obesity because it is an issue no matter who or what, no matter who is teaching us, no matter the narrow-mindedness or the elitist attitude of who is teaching us, it's still unnecessary, especially when it comes from lack of exercise and or lack of restraint. You know what I'm saying? It's about changing your attitude and your mind. And now we're talking about unwanted pregnancies, especially in states where certain procedures regarding unwanted pregnancies are not tolerated and are punishable by criminal prosecution. Child. So Dr. Simone is schooling her patient on the effects of having babies, after the acceptable maternal age. What I mean by acceptable is that at a certain age, a woman is considered old because we have our eggs when we are in utero. So they're always, there and working per se, and building up and developing in a way and ready and so because they're available for so long, by a certain age, I believe it's 35. There's certain chromosomal or just certain abnormalities that can happen, and they're discussing those. And because she is married, she's also being schooled on the husband notification as well. So everybody got to be aware that everybody has to be aware of what's going on. Can't, even though it is her decision, and also costs of things when we have to go out of town to take care of things. So it's a full-fledged, all-around overview that I'm glad Dr. Simone is well versed in, so that she can adequately and efficiently give her patients the information that they need. And that's a great, great, great conversation to have. I mean, Next, we got fine ass Dr. Eugene and their family going, getting the boys' teeth taken care of. Braces are being talked about, but then they start talking about how jocks and certain people, certain demographics in school will have a certain demographic or caliber of women to select from, and vice versa. So they're talking about pretty much the standard, how the jocks get the good girls and the nerds get the girls who are less attractive. And they're just having fun with their kids and talking and whatnot, and how it's really sweet to know that his kids believe that Dr. Eugene, who was a nerd back then, was lucky to get a woman like their mom. That's just so sweet because they really look up to their parents and they have a very good family. I really hope their boys grow up, and I'm pretty sure it's mostly due to Dr. Eugene and how great of a role model he is. It's just something I've noticed about him since season 1. He is a great role model to his children, maybe not financially because of the issues that he purposely got into, but I'm hoping that that is a thing of the past. But for the most part, showing them how to be a man, taking care of their families, especially if that's the route that the boys want to go into, then he is an exceptional father and husband, and I wish them all the best. So next we got Sweet Tea and Dr. G. Now, this was a little, this was a little, informing because it was kind of weird because of all the things that's going on with Sweet Tea and Dr. G. He's concerned about her health, and so he wanted to come along for the ride. And I'm sure she wanted him to come too because he is a doctor. And, pretty much, she also wants him to chime in and possibly ask things that she wouldn't. I would if my man was a physician, even though he is a physician of psychiatry, they still go through the basics of things, and so he's getting more informed as well as far as her issues with her endometriosis. And you know I'm sure that it was a calming, soothing thing for her husband to be there. She loves him. He definitely loves her, and I wish her all the best with everything, with what she's going through. So next we got the funny Whitlow. Wait, no, what's their name? Whitmore. I'm thinking of Whitlow from Love and Marriage with fine ass Lewis and his wife Tiffany. Anywho, yeah, I said it like that. We don't like Tiffany. Ain't got nothing to do with her post, whatever. That was way before the baby. She is not liked, but we ain't talking about them. Big ups to them now. Yeah, so as we see, they're happy that their kids moved out. I know that's right, because my kid don't live here no more. He got his own place, Joe. Dr. Simone is being her funny self and going with her light to check for semen and blood. I don't blame her because she know her kids. I think that's perfectly fine. I think that's perfectly acceptable. I think that's perfectly okay. And she said she only had to check in one area, which is here's the youngest. Hello. The oldest ain't about that life, but apparently the young one is. So as you shall wait before we go there, you see how she got to check because she know her kid need to clean. She checking for the essentials because she said, if y'all didn't catch my review in the previous episode, they need to keep that place clean. It is an investment property, and they bet not find nothing but just maybe dust mites and maybe some streaks of food that they didn't clean up. It better not be no rat roach or nothing up in there, and I don't blame her. And we gonna supply y'all with the first 8 packs of bleach, 8 bottles of bleach, 4 packs of everything is supplied at first, and then you just keep it going. But yeah, Michael, that's the one being looked at. He got 2 years left in there, so he could possibly live there by himself for a year. But Miles, that's his name, Miles. I think he has 1 year left. That's it. The first year, that's it. That's all, because he should be out of school. I think Michael got 2 years left. But anyway, I'm with it. Because listen, I fully understand everything they talking about, and I fully get it. And you just need to put your foot down when it comes to your children. We love them dearly. Of course, we want to keep them safe and close to our bosom and everything. But hey, it's time to go. It's time to go. Bye. Love you. Anywho, so like I said, the guys, let's get to these guys. They're having they're having their drinks and whatnot, not what. And that fool right there on the left, he talking about now he's from, did he say Nigeria? I forget. Ghana? I forget which country in Africa he's from. He said where he's from, the man rules is whatever the man says, no matter what. But in America, the women taking over and the men's nuts is cut off. Now, you see, Dr. Dane was like, wait a minute, I feel offended. But everybody was like, but he was like, I respect how you rule your household, but I kind of feel He was taken aback from that comment. So I just see the guys is cracking up, laughing. On the left of him is what's his name? Dr. Jackie's husband, the one that cheated, Curtis. He over there laughing too. They just laughing at the man, like, man, whatever, man. We good in our relationships. We've been through some shit like you have, and it is what it is. But for the most part, your wife is American, and it is what it is. But she definitely respects her husband, as you can see. He's just saying how he'd rather keep it his traditional, child. I mean, growing up, but it ain't gonna be traditional, boo, because since you already saying that the wife taking over, she didn't took over. Mm-hmm. So as the ladies are getting ready for this PSA for Dr. Jackie, and I'm gonna show y'all what the PSA is. It was so great. Oh, it was so great. Sweet Tea is talking about how how her appointment went, and she's gonna have to have surgery because the cysts are where they are, and she's having pain and whatnot. Not what. Then she went on to say how she has sarcoidosis too. And like I said, as a healthcare professional, I looked that up, right? And I'm like, well, all these conditions you got, and you want to have a baby. That's real interesting. So I looked it up. Now we already know what she's saying and talking about, and the doctor was explaining how endometriosis can cause a delay in conception, and if continual, medical and surgical interventions for the endometriosis prior to conception occurs, then the possibility of a natural and organic conception will probably not happen, and you'll have to look for alternatives. And we all know what those alternatives are. Maybe not even in vitro, because your innards are damaged to the point where you cannot carry, and then there's the issues of, surrogacy and adoption, all these other, way great options of obtaining a child in your life. Everybody wants their own baby, fine, but there are so many kids out there who need homes. The horror stories we're hearing, breaks my heart. But I really wish it's just so many things that need to be fixed. But yeah, so back to this sarcoidosis. I looked it up, right? And I'm like, sarcoidosis and pregnancy. Now, this is from a website I took, and nih.ca.mlb.com. And, it's like, if you read it, it's saying that there could be a lot more associated risks because you have sarcoidosis. And it's just, and this is the issues with the endometriosis, same website. But I'm just like, if you have all these issues, girl, I mean, to be honest, sarcoidosis is, and then she said it's in her lungs, where the lymph nodes in her lungs, enlarge, and it's hard for her to breathe. Girl. And I'm thinking, how come she never mentioned that when it comes to, you know, uh, getting pregnant? Because outside of the endometriosis, the sarcoidosis is serious. I'm just saying, that is a serious thing. And I would have imagined that conversation would have taken place way before endometriosis. Consider she's had sarcoidosis longer than so-called knowing about her endometriosis. And I say so-called because some, I don't know, something phony with Sweet Tea. She keeps coming up with not coming up, but I'm just saying, she keeps, bringing up all these, issues that are serious with her health. And I'm like, ain't nobody ever told you that because of your sarcoidosis, pregnancy, there will be complications with pregnancy, considering, your body's going, child, listen, I look, I know I am a healthcare professional, but I ain't no licensed medical doctor, nothing. But I do know how to research, and I do know how to look up things, and just look it up, sarcoidosis and pregnancy. It'll tell you everything if you want to look up some more stuff. But yeah, back to the PSA. They had a little argument about who going first, second, third, fourth, but then they pretty much straightened it out. And in the end, I thought this was so great, and I want to share it with you. The nation's highest maternal mortality rate is with African American women. And it's a shame because, from my perspective, it's the patient care that's the problem. It's the mindset of who's taking care of the patient. It's not the issue of the African American woman, as Dr. Jackie, said in that shameful, video from years ago with Dr. Heavenly. It's the person or persons taking care of the African American woman. That's the problem. So if we get rid of that, the outcomes, in my opinion, wouldn't be so doggone high. Nearly 75% of deaths related to pregnancy occurred amongst African American women. And actually should say Pan-African women, because it's happening to us all over the globe. That's just my opinion about, rewording it. And it's doggone ridiculous. Race-related health disparities. I've had my share of race-related. Now I'll give you a real quick one, real quick. I get migraines, and usually they last about 48 hours. And sometimes when it's so severe, when my own medication doesn't help, I have to go in and get a shot. So this particular time I saw a Caucasian looking woman. I think she was a PA. Whatever her whatever her licensure is, she is qualified to treat me. All right. So she immediately came in, sat back in her chair, real cavalier. We only give time off from work for one day. Why is that the first fucking thing she said to me? So I had to quickly let her know. I said, well, if you look at my chart, you'll see that these things last at least 2 days. So I'll need at least 2 days off from work. And she gave it to me. That's what I got at the end. And then something else she said. Just real cavalier and just, and didn't even look at my chart then. After the exam was done, and she didn't even touch me, mind you. She didn't touch my head. She didn't feel how you can literally, if you touched my forehead or my temple, you can feel the pulsation. It was just horrible. Anyway, I'm getting mad about that, but that's just a quick, purview about me. And most resistant to progress are those who take care of us. Ain't that nothing? And in the disparities, get rid of these people with these narrow racist mindsets that are making us guinea pigs and whatnot, and get some real folks in there who care about us enough to at least fight for our lives. We should be doing more, and we are dying more. It's a doggone shame. And with that being said, I just want to let y'all know we got to do better. The clinicians of medicine need to do better.